So I got a question about pain when kneeling. And there can be 3 areas of the knee that can be causing the problems for the pain when you're kneeling. It could be actually in the kneecap itself, it can be in the center of the knee, and it could be in the back of the knee. Each of those areas indicate a different problem going on. So if the issue is in the kneecap itself, that means there's some sort of tension pattern going on in the kneecap that would need to be addressed. Taking the kneecap to comfort and getting the pressure off of the nerves that are causing that problem. If it's in the center of the knee, there can be a function of the rotation or the lining up of the bones in the lower leg and the bones in the upper leg, and how it is impinging on the meniscus when your knee bends. Meniscus, of course, is the spacer, the shock absorber between the bones in the upper leg and the bones in the lower leg. And it could also be pain in the back of the knee. And if there's pain in the back of the knee, that could be another function of the lining up of the bones in the upper leg and the bones in the lower leg. My approach to that, of course, is creating the space by getting the pressure off of the nerves in the knee. When you get the pressure off of the nerves, the knee pain goes away. It's not rocket science. It's actually very simple and straightforward. Now, I will have a caveat to all of this. You want to make sure if you've had pain for a long period of time, you get it checked out first. You go to the doctor, you get an x-ray, a CT scan, or an MRI, something like that. Have a doctor look at it, make sure it's checked out. There isn't anything mechanically wrong. And when I say mechanically wrong, I mean nothing is broken or torn. And once we get that ruled out, then my program is like good to go as far as getting rid of the pain very quickly, very simply, very easily, because it's all about creating comfort, putting you in the comfort zone. And by creating comfort, when you're kneeling or however else your knee is moving, if your knee's comfortable, there's no possible way it can hurt. It's kind of a gimme. So that's my approach to pain when kneeling. Get as much information as you can, see what works for you, see what fits for you, and make the best choice for your knees as well as your body.